Welcome to My Hometown, the program that explores clubs, organizations, businesses, and issues across Nassau and Suffolk counties and sheds light on the different towns that are making a difference.
And a great day to you, and welcome to another edition of My Hometown. I'm your host, radio personality Rita Monte, and I'm on with NCC student Rita. And our special guests today are Ellen Lockwood and Rita Lockwood. Our main topic will be how pet therapy can help people and what some of the benefits are. Among other issues, we'll inform you on how to train your puppy to be a therapy dog, and we will explain what Pet Partners Therapy Animal Program is. And I would like to welcome today to My Hometown Radio, Ellen Lockwood. How are you?
Good to see you, Rita. Thank you.
And later we're going to meet Rico as well. Okay, Rico is going to be the mystery person here today.
That's great.
The important person, but the mystery person. So welcome to My Hometown.
Thank you.
I'm very prepared for a wonderful show today. Very excited. And so we're going to jump right in. What is Pet Partners? Tell us about it.
Pet Partners is the nation's largest nonprofit organization, founded in 1977. It is the leader in demonstrating and promoting positive human-animal activities and education. It registers handlers of multiple species as volunteer teams and provides animal-assisted intervention. It has more than 15,000 therapy animal teams in 50 states and makes more than 3 million visits a year. Pet therapy is a broad term. It includes animal-assisted therapy and other animal-assisted activities. You can use animals to help people recover from something such as a serious illness or cope with health problems such as cancer, heart disease, mental health disabilities. It improves the physical, emotional, and psychological lives of those we serve.
Okay, that's great. You know, Ellen, when I first called you, I really was not aware of this, and I think a lot of people should be aware. I thought that Rico, the dog that we love so much, was a service dog. I said to you the word service dog, and you got a little you're like, no, it's completely different, service dog and therapy dog. So tell us the difference of the two.
Correct. There are differences, and most of the public is confused. There are service dogs, there are therapy dogs, and there is something called an ESA dog, which is an emotional support animal. They are for different needs, and they also are covered legally with what they can do and where they can go legally, differently by the Disabilities Act. A service dog helps someone who has a disability. It does a task or a function. A therapy dog works mainly on the emotional and animal-assisted reaction between the person and the dog. It can facilitate physical changes such as lowering of blood pressure, lowering of anxiety, adherence to a program that needs to be done, such as a chemotherapy program. And an ESA dog is an emotional support animal that is used for someone who might have anxiety and needs the dog. The coverage between the three is very different. A service dog is allowed to go where that person is going, such as into a restaurant, an airplane, a theater. A therapy dog does not have that same coverage. An emotional support animal, the one thing that it is covered by through federal law, is that if you are in a complex that does not allow dogs or have dogs in your apartment or condominium, something like that, an emotional support animal with a letter from a mental health professional will override that problem of not being able to have the pet with you. But legally, that pet, an emotional support animal, is not allowed to go, just as a therapy dog is not allowed to go where the service dogs are. And there's a big problem with fake vests going on now. Really? And people who have service dogs are having a tremendous problem with the fact that these other dogs that are not service dogs and know those 50 commands that are taught to a service dog are being distracted in doing their jobs by a therapy or an ESA dog, or someone in the public who just goes online and gets a fake vest.
But what is this fake? How do they get a fake vest?
They go right online to eBay or Amazon, and you just pay a couple of dollars, and it'll say service dogs. And unfortunately, someone like in a restaurateur, is not allowed to ask for proof or papers, how it stands now. There are only 12 states in the United States out of 50 that have large fines. California is the leading one. California has a 6-month jail and $2,000 fine. But all of the others, if the person is caught, is just like jaywalking. It's a misdemeanor.
Wow. Yeah. I wasn't aware of that. So we have Joe Rita here with a question.
Yeah, so...
NCC student.
Yeah, so we talked a lot about service dogs, ESA dogs, therapy dogs, but is it only dogs, or can you get more animals?
Well, that's an interesting question. Pet Partners is the only nonprofit organization that covers about 9 species of animals. So, you don't only have to have dogs. You can have llamas, mini horses, pigs, cats. It's very much fun when someone's in a hospital and a mini horse walks into the room wearing sneakers so that they don't slip on the tile.
Right.
So it's not just dogs.
And of course trained. They are trained
totally
as
trained.
well.
Pet Partners, you are reevaluated every 2 years, not just the dog or the animal, but the handler. Not only does the dog have to pass about an hour's test of simulating a visit, such as in a hospital situation, but the handler has to pass. If either one fails, the team is rejected.
Wow.
Pet Partners covers you with a $2 million insurance policy, and they want to make sure that the animal is taken care of, not just that the animal is constantly working. You can only work a maximum of 2 hours with the animal. And the acronym is YABA. You are your animal's best advocate. If you're in the middle of a therapy session and that dog, for whatever reason, it may just not be right that day, just like humans are, having a problem, and we are trained to see if the animal is stressed. Is he licking his lips? Is he yawning? Is he stretching? Is he laying on his side? Every owner will know what the stress signals are, and that's gone over as part of the test. You stop the visit right there and come back another day, because it has to be fun for the animal to work.
Yes.
They can't tolerate people, therapy dogs. They have to love strangers, and that's the sign of a great therapy dog.
And I'm sure it's stressful on them as well to see someone suffer or not feeling well.
Each animal is different, and some animals, like a service dog, many times you have a problem when you want to retire a service dog and the new service dog comes in. The old service dog wants his vest on and to go to work and do what he wants to do. So sometimes not working is stressful. My own dog, if we don't go, let's say, to Ronald McDonald House for a couple of weeks in a row, he wants children. He wants interaction.
And how do you know that? How can you perceive that?
You will see that he's stressed. First of all, he will look for children in other places. He can start sleeping more. Once he starts sleeping, just like a human, he's getting depressed. Something out of the ordinary.
So you have to be just as aware on his...
Which is why Pet Partners is so wonderful, that they give a handler's course that you must pass before you even go for an evaluation. And part of the course is that part of the testing is testing the handler on what they know about that specific animal. And as animals age, people age. So instead of testing them once in a lifetime, they test them every 2 years to make sure. And the test itself simulates a visit. If you have someone angry and yelling at the doctor that he didn't get his pills or he doesn't feel well that day, and they're dressed up with canes or crutches or a wheelchair, and then they call the dog over, that dog has to come to them. That's part of the test.
Yeah.
I work with children. You have young children that, especially preschool, they get excited when they see the dog. They all rush over, 4 or 5 of them. I have to know how to get everyone in line. And yet there's something called restrained hugging. And that's a test. That's part of the test. So basically, you have a dog that loves people. Like Rico will sit down even when I walk him when his vest isn't on. If he sees someone outside their house in the driveway, if a man is waxing a car, I have to ask them to pet him. Right. And I explain, he's a therapy dog. He loves to meet people.
Right, yeah. So before we were talking about the Ronald McDonald, you were talking before. Who do you serve with pet therapy? What kind of population, and also the venues? Where do you go with the dog?
There are many places that we go. We serve venues such as hospitals, schools, libraries, nursing homes, veterans administrations. It's very varied. Pet therapy, we can be working with a veteran with PTSD, or a senior with Alzheimer's, or a student who has literacy challenges. And there's such a thing called a Read With Me program, because the dog doesn't tell the child that's the wrong word. You didn't pronounce that correctly. The child is relaxed, and it's been shown when studied that the child who read below grade level now comes up to grade level or beyond, just from having the book buddy of the dog. And you will see that most libraries now around the country will have a dog book buddy program.
That's great. I saw these little captions on dogs, and I just wanted to read one, and I love this one because we were talking about children. A dog teaches a boy fidelity, perseverance, and to turn around 3 times before laying down. Robert Benchley. I love that saying.
I love that too.
And it just goes with so excuse me. So let's get to the nitty-gritty of the interview. How does pet therapy help people? And what are some of the favorable benefits?
If you go onto the website of Pet Partners at petpartners.org, you can read the actual studies on the site of the benefits of a human-animal bond. But in essence, it's been shown to activate endorphins, which are chemicals that are the feel-good chemicals, such as when runners talk of a runner's high. Those are endorphins. It's been shown to reduce blood pressure, stress, anxiety levels, helps reduce pain levels, such as a study on fibromyalgia and joint replacement studies. It improves behavior with children who have autism spectrum disorder, and the stimulation of the chemicals makes a difference very quickly.
So, can I ask you real quickly? So, we talked about there's a lot of different animals that can become dogs or become therapy pets. So, could it be like any breed, any type of animal, or are there specific ones that you use?
There is no specific type of animal that you can use any breed. It's not that you're just looking for a purebred or a mixed breed, but it depends on the animal. It really depends more about temperament and not breed.
So are there like specific types of animals then that are more catered to specific like needs then?
I would say that something like that, I look at the dog. It could be a Yorkie or it could be a Great Dane. It could be a cat, or it could be a guinea pig. It could be a rabbit, which is a lot of fun walking in and seeing a Pet Partner's vest on a rabbit or a mini horse. I get a kick out of that. But basically, that animal wants to be petted. That animal wants to be noticed. And that animal needs to be with a human.
Right.
That's great. That's great. So we're going to take a short break and from my hometown show, and we'll return with our special guest today, Ellen Lockwood, and we will talk about a little bit more about pet therapy and how to help people.
Today we decided to walk to school. At the corner, we waited to cross the street. The stoplight counted down. 15, 14, 31, 13. We took a left on Carroll Garden Street.
Garden Street?
Loud music was coming from a car. Danny's a smart kid, but he gets so distracted.
There were so many other sounds, I didn't know what to focus on.
Danny, Earth to Danny. Suddenly he realized he forgot his homework again.
I left my homework on the table.
At the school steps, we hug goodbye. I really hope he doesn't have another bad day at school today.
When you can see learning and attention issues from